In this video, we'll be talking about the fascial spaces. So we'll basically, for the purpose of teaching here, we'll be categorizing them into 4 spaces. Those that are related to the maxilla, and those that are related to the mandible and the surrounding area. And then we'll be talking about the fascial spaces that are called the masticator space, and because masticator space contains many spaces. And then finally we'll go to the cervical spaces, so 4 main spaces. So we'll use some scissors and a pen and some sticky note, our skull. So welcome to the art class. Alright, so first consider this pink sticky note as the buccinator muscle, okay, and this one here, the blue one, is our masseter. So it will go here from the zygoma. Alright, so what if the infection, so you consider this is a space, this is the space where you just reflect the oral mucosa, the cheek of your patient, and then this is also another space between the masseter and the buccinator. So what if your infection, I don't know if it's clear in here, we should rotate it for you. So what if your infection is below the attachment of the buccinator muscle, like it's here, it's in the posterior teeth, but it's below the attachment? Then you'll find the swelling on the vestibule here. This is called vestibular space of the maxilla. The same thing goes on the mandible. So if it's above, because this is the attachment. So if it's above the attachment, then you'll find the swelling in the vestibule of the mandible related to molar teeth or posterior teeth. So in the maxilla, if it's below the level of the buccinator muscle, you'll see a vestibular swelling in here. On the mandible, if it's above, because this is the attachment, if it's above the level, like it's here, then you'll find the swelling on the vestibule. If it's below the level, then it will go to another space. If it's below the level, it will go to another space here. If it's above the level in the maxilla, so it will exceed the attachment and it will go to another space here. See the difference? This is called vestibular space of the maxilla, vestibular space of the mandible. Below the level will go to the buccal space, and in the maxilla above the level will go to the buccal space. Okay, so from here, if you know your anatomy, I strongly advise that you review at least the muscular system on the anatomy video. So if you know your anatomy, you won't just know the boundaries of each space, but also the communications, how spaces communicate with each other, and then the content of each space, what exactly passes through each space, and then you'll know signs and symptoms. You'll know there will be pain if it's pressing on a nerve, if the swelling is pressing on a nerve, or if it's in a confined space, that will certainly cause some pain and discomfort to your patient. And if the space allows for some swelling, then you'll certainly find swelling. And if the infection is involving muscles of mastication, you'll certainly find trismus. That's an example for you. Now we have a swelling here, and the swelling is below the attachment level of the buccinator. Buccinator is the cheek, and it's covered by the mucous membrane. So you will be reflecting the vestibule. Oops, our swelling is gone. So what you'll find is a swelling on the vestibule here, because it's below the attachment level. And your lateral wall of the vestibular space of the maxilla, the lateral wall, will be your mucous membrane here. That's covering the buccinator muscle. The oral mucosa and the area that's covering the buccinator muscle. If the swelling is in the mandible, the same thing applies, but then you could assume that there will be some communication with other spaces in the mandible. Okay, that also depends on the attachment level. Is it below the vaccinator or above the vaccinator muscle? Alright, so what if your infection just goes here above the level of the vaccinator and the maxilla? Then it will certainly pass through this area to go to the buccal space. So medially you'll find your vaccinator, and laterally you'll find your masseter, or sometimes it's just situated posteriorly even. And then you'll find also on the medial side here, again, it's better if you revise the anatomy, you'll find the medial tragoid slinging on the mandible. So both the masseter and the medial tragoid are slinging on the angle of the mandible. The masseter is from the lateral wall, and then the internal tragoid is from the medial wall. Your buccal space certainly contains buccal fat bed, and then there's the platysma inferiorly, and certainly it could go to the submandibular space. So if the infection is here in the buccal space, it certainly can go posteriorly all the way there. Okay, all the way there. This is called the infratemporal fossa, because this is the temporal bone, and inferior to it is the infratemporal fossa, and it could go all the way there to the pterygomandibular space. So here, the infratemporal space, and here pterygo means posterior, pterygomandibular space. Buccal space infection can also go anteriorly, and it could go to the submandibular space inferiorly, or it could go just to the midline, to the canine space and the upper lip space, the base of the upper lip. Okay, since we mentioned that the infection could go from the buccal space all the way to the midline, to the canine space, or the base of the upper lip, then we'll be talking about the canine fossa space and the base of the upper lip space right now. As a matter of fact, there are some books that consider the base of the upper lip space to be the same space of the canine fossa here, but we'll be explaining them separately in this video. So the base of the upper lip, it's here. What you'll find is an obliterated philtrum, because it's on the midline. The philtrum will basically be obliterated in here, but on the canine fossa, you'll find the nasolabial fold to be obliterated, because it's here. This depression is called the canine fossa in here. So here the philtrum is obliterated, but here is the nasolabial fold is obliterated in the canine space infection. Anterior to the canine space and the base of the upper lip is a big muscle here that's called the Orbicularis Oris. There are a group of muscles that are attached to the upper lip. These are levator oris. So levator, it elevates the upper lip, and then there is also the levator anguli oris, because it elevates the angle of the mouth. And we have other muscles that are attached to the lip and the zygomatic arch. These are called Zygomaticus Major and Zygomaticus Minor. What makes the base of the upper lip a dangerous space is because its attachment to the superior ophthalmic vein. The superior ophthalmic vein communicates with the cavernous sinus. So what's this relation of the ophthalmic vein with the base of the upper lip? Because it goes to the nose and then to the angle here of the eye and then to the cavernous sinus. From the infraorbital foramen, there is a nerve that's called, of course, it's a no-brainer, infraorbital nerve. So patient might find some pain related to the canine space infection. These two spaces also may cause swelling and edema of the lower eyelid. The lateral incisor with the palatal roots of posterior teeth may also cause some palatal abscess, so you'll find that abscess on the palate. Alright, so we're done with the first group, the vestibular space of the maxilla, vestibular space of the mandible, buccal space, canine space, and then the space of the base of the upper lip. So now let's just talk about the second group, which is the space of the body of the mandible, and also the spaces that are below the body of the mandible, and also we'll be talking about the masticator space. So masticator space is a general name, and it includes temporal space in here. Infratemporal is an extension of the temporal space in the infratemporal fossa. And then masseteric. Masseteric is between the masseter and masseteric. Masseteric is between the masseter muscle and the lateral surface of the mandible. The difference between the buccal space and the submasseteric space or the masseteric space is that the buccal space is anterior to the masseter muscle, but the submasseteric is called sub, so it's underneath the masseter muscle. So it's here between the lateral surface of the mandible of the ascending ramus and the masseter muscle. There is also an extension of the temporal space. I'll turn the skull to show it to you. It's called the pterygomandibular space. All masseteric spaces communicate with each other. You could find an infection in the submasseteric area that could go to the infratemporal, or infratemporal that could go to the submasseteric, or temporal that goes to the infratemporal, and then pterygomandibular or submasseteric. All parts of the masticator space communicate with each other, and they also communicate with the submandibular space and the cervical space, as well as the pharyngeal space or parapharyngeal space. So we'll add the temporalis here. It goes here to the crinoid. It's attached to the crinoid. Attachment is here in the crinoid. So consider this the fascia that covers the temporalis muscle. The space is here. This is called the temporal space. So it's between the fascia and the temporalis muscle. Any infection in this space is called temporal space infection. So as we turn the skull posteriorly, we find the sphenoid bone, and this is the medial tragoid, and this is the lateral tragoid of the sphenoid bone. And this is the medial tragoid. It's inserted here in the lateral tragoid, the medial surface of it, into the angle of the mandible. I'll remove it so that you can see the lateral tragoid. Lateral tragoid is here. It has two heads, just like the medial tragoid, and then it's inserted here in the condyle. So this is the condyle. So it's inserted here. And also its insertion is explained in details in the head and neck anatomy video. All these muscles. So the pterygomandibular space is here. It's considered part of the temporal space or the infratemporal space, and is formed by the lateral tragoid here of the sphenoid bone, and also lateral tragoid muscle here, medial tragoid muscle in there, and also the mandibular ramus. So this is our space, the pterygomandibular space. This space also, as you know, encloses here the inferior alveolar nerve, because this is the foramen. of the infraalveolar nerve. So we have here blood vessels, nerves, that's why the space is important. As you can see, this space can easily communicate with the submandibular space and the parapharyngeal spaces. This is our masseter space or submasseteric space. This is our masseter muscle and the lateral surface of the ramus. So this is our space. The masseter muscle is a bulky muscle, so you can consider marked trismus if there is submasseteric space infection. So this was our temporal space infection. How about our infratemporal space infection? I'll remove the fascia. I'll also remove the temporalis so that you can see. So as you have seen, that this is the tragoid plate and this is the tuberosity of the maxilla, and there was the temporalis here, so we removed it. So this space is called the infratemporal space between the maxilla in here and the temporal area. The infratemporal fossa encloses vital structures. These are maxillary artery and branches, mandibular nerve and its branches, and the tragoid plexus. Tragoid plexus have communication with the cavernous sinus. Certainly, the infratemporal space could communicate with the submasseteric here, and it also could communicate on that direction with the submandibular space infection, and it could go on the medial direction to the parapharyngeal spaces. There is also another structure. I assume you know what that structure is. This is the parotid gland, and the parotid gland space basically has nothing but the parotid gland itself. And from the anatomy video, you should know that there are several important structures that pass through this gland. These are the facial nerve, external carotid artery, and the retromolar vein. Right, so now to the other group, the space of the body of the mandible, and submandibular, submental, and sublingual spaces. We'll start with the space of the body of the mandible. So this one is the periosteum, and just consider this the periosteum. And then the space between the periosteum and bone is called the space of the body of the mandible. So it extends from the symphysis all the way here from the buccal side, and then from the medial side as well, it's in the same location. So you can assume anteriorly on the lateral surface there's the masseter, and then posteriorly on the medial surface there is the medial tragoid, because we said that the masseter and the medial tragoid, both of them sling on the corner of the mandible here. So all this is called the space of the body of the mandible. It's here between the periosteum and the bone. If you're wondering what periosteum is, it's the dense vascular tissue that covers the bone here. So it comes in direct contact with the bone, and it extends all the way to here because it covers all bone surfaces. And yes, this space also could communicate with the vestibular space infection. So this is our vestibular space infection, and this is the space of the body of the mandible, so it could communicate with this one. On the lingual side here, it could also communicate with the submental, submandibular, and sublingual spaces. Okay, it's time to talk about the submental, submandibular, and sublingual spaces. So we'll remove all these muscles. Okay, so the red long line here is the mylohyoid line, and so we'll attach the mylohyoid here. This is our mylohyoid. So this is our mylohyoid muscle. On top of it, there's the lingual gland, and beneath it, there's the submandibular gland. So, you know what's coming next. This is the sublingual space, and this is the submandibular space. The submental space is in the midline, so it's beneath the mylohyoid bone. If we turn this here, this is our platysma, and just consider that there is a hyoid bone. The bone is the hyoid bone, because the hyoid bone is suspended inferior to the mandible, and it's attached superiorly by suprahyoid muscles and inferiorly by infrahyoid muscles. And the submental space is here. The submental space contains submental nodes and anterior jugular vein. The submandibular space contains the submandibular gland and the submandibular lymph nodes, as well as the facial artery. The submandibular space could communicate with the sublingual space and the submental space anteriorly on the midline. It could also communicate with the parapharyngeal spaces. So this pin here is the pharynx, and the area around it is called parapharyngeal spaces. So the submandibular space could easily communicate with it. The sublingual space here contains the sublingual salivary gland and the submandibular nerve and artery and the hypoglossal nerve. Okay, finally, cervical spaces. So this is the pharynx. This space is called lateral pharyngeal or parapharyngeal because these are lateral to the pharynx. If it's posterior to it, then it's called retropharyngeal because it's posterior to the pharynx. So lateral pharyngeal or parapharyngeal and retropharyngeal. This is our vertebrae. So if it goes also anterior to the vertebrae, it could be called prevertebral spaces. So if it's anterior to the vertebrae and posterior to the retropharyngeal space, there is another space here that's called prevertebral space. Cervical spaces communicate with each other just like the masticator space. The infection can spread from the retropharyngeal to the lateral pharyngeal, or from the lateral pharyngeal to retropharyngeal, and then goes to the prevertebral space. Also, cervical spaces could go to vital organs, just like the heart and lungs. So dental infection could spread all the way there. That's why it's important to contain it before it spread to these spaces, especially the prevertebral space, and it's called the alar or danger space. The parapharyngeal space runs parallel to the carotid sheath. The carotid sheath contains 4 structures. These are the common carotid artery, internal carotid artery, internal jugular vein, and the vagus nerve. There are also other nerves that run parallel to the retropharyngeal space. The 9th cranial nerve, 11th, and 12th. These are glossopharyngeal, accessory, and hypoglossal nerves. Infection in the parapharyngeal spaces and the sublingual and submandibular spaces can go very fast, so it's important to contain it very fast as well, because if it goes here to the submandibular and then the sublingual could go to the other side, the submandibular of this side, sublingual of this side, and then it crosses the other side involving the submental causes, and then it goes Ludwig angina. And the same thing here in the pharyngeal spaces, because if it goes to this side, the parapharyngeal space of this side, it could go to the other side, and it could go to this side in here, the retropharyngeal. So, and the course of the infection could go very fast, hence the name danger space.